this. All right, good morning, everybody. Today is the first official meeting of a new OHDSI work group. This is the Health Economics Value and Assessment work group. I do have some slides that I want to go through. We want to go through what this work group is about, the OKRs, the work group logistics, what it is, who, and so on. But before we do that, let's talk about who we are and why we are here. Why were we members of this work group? I'm sharing my screen here, and I just wanted to show the structure of the membership, I believe. Let's see. If I look at this managed team members, we do have 28 members registered right now for this work group, which is really good. So this is the process of signing up. And as of today, we have 12 people attending. So I would love to hear who you are, and if you could please go ahead around introducing yourself very quickly, that'd be wonderful. I'll start. My name is Gowtham Rao. I've been in real world evidence space for a very long time. My background, I'm a medical doctor. I'm a long-standing OHDSI collaborator. I've contributed to the OMAP common data model, the OHDSI software, and various methods research. Who wants to go next? Maybe Gaurav, since you're co-leading, would you want to go next? Yeah.
Yeah, I can do it. Hey, my name is Gaurav Dravida. I've been in the real world evidence industry for a little over 2 years now. Basically, I've just been helping Gautam kind of start this work group again, revitalize it. Great word that we like to use because he did come up with this, I think, like 5 or more years ago, and then kind of just fizzled out. So we're starting up again, and this is going to be huge for this OHDSI community because we haven't really tapped into this field as much as we should have.
Who wants to go next?
I can go next. Hi, everyone. My name is Daria. I work with Gowtham and Gaurav. So I've been with Odysseus EPAM since 2020, and naturally with the OHDSI community. I'm very interested in health economics research, so I'm supporting this group whenever I can.
Yeah, let me go next. Yes, hi everyone. I'm Sajjan Madapadi, and real world evidence is something new to me. So been 3 months into this aspect, exploring it. Very interesting, mind-boggling together. Right. From the background, I'm a medical doctor and happy to be part of the community and explore the entire space. Thank you.
Welcome, Sajjan.
Hi there, I'm Alex, working in EPAM, working with Gowtham, Gaurav, Jack, Daria, and also in some people here. I'm interested in this field. I'm actively participate in the process of development, some cost utilization tools. And I believe, as Gaurav, I believe that we should develop this field as much as possible, just because it's really valuable for in our life, in our scientific purposes, and in business, actually. Thank you.
Yeah, I agree. I can go. I'm Jack Murphy. I'm an epidemiologist at EPAM. I started about just over a year ago, so pretty new to OHDSI and all that as well. And I was particularly curious about this work group because I've always heard that there's a lot of overlap between epidemiology and economics methods, and I just want to see what that's really like. And so health economics seems like a perfect mix of those. So curious to learn with everybody.
Welcome, Jack.
Thanks.
Hello, if I may go next.
Yeah.
My name is Marko Čavlina. I'm from Croatian Institute of Public Health. I'm in charge of OMOP metadata meta catalog, and we're not handling economics, but it's an area that's of interest of mine. So I'd like to observe.
Yeah, and which part of Croatia are you in?
Right now in Zagreb, capital.
Oh, okay, excellent. Beautiful place, beautiful country.
Hello. My name is Imelda. I am from Uganda. I am a health economist, but I'm looking at exploring different areas, different specialties. I do not know much about HEVA, but I am hoping to learn as much as I can.
You're so welcome. Welcome. Thank you for joining us.
Hi. If I can go next. I'm Bernardo from Portugal. I'm an internal medicine doctor, and during the last 2 years, I've been working in the data science team of my health group in Lisbon. And starting next month, I'll be working on a value-based healthcare working group of my hospital system. So I just saw your email, and I saw it was a good idea to check it out.
What a perfect timing. Awesome.
Hi, I'm Kyung-sun at Yale University School of Medicine, working with Holland. My background is in HTA and health economics, and I've been involved with ODC for about 4 years. I'm currently developed an econometric tool for burden of disease research, and now I'm studying bevacizumab cost effectiveness study using OHDSI, CDM. So I'm here to collaborate and learn how OHDSI approaches can advance health economics and value assessment. And I want to collaborate, and I'm eager to contribute to society. Thank you.
I feel like the OHDSI community has been looking for people like you for the last 4 years. So you joining this work group and at the day of kickoff is fantastic. Thank you, because we definitely have the same interest that you do. Don't be shy. Anybody else?
I can go next, Gautam. My name is Ram. I'm at Gilead, and I support real-world evidence. I've been doing it for a very long time, just like Gautam. I started my career on the actuarial side in health insurance, and I supported HEOR work for most of my life. Thanks.
Thank you, Ram. Toby.
Hey there.
Go ahead, Sam.
Yeah, hey there, this is Shishir. I was just running and I saw this, just wanted to join in. I'm a health economist. I do a lot of research that relates with state health laws and policies. A lot of work has changed state laws in the US as well. And, a lot of time people talk about the individual data. So I got into OMOP CDM last year, did some work, but it was more into like ICU care setup. And I want to look into more economic valuation and stuff. So really excited about it. Thank you, folks.
And which part of the world do you live in?
Right now, I'm in Appalachian State University. It's in North Carolina.
Excellent. Awesome. Looking forward. All right. Before anybody else really want to introduce themselves, because now is your last person. Then, okay, going once, going twice, going 3 times. You're done. All right. So let's kick off the formal part of the meeting today. So let's. I have 3 slides. Before I go through the slides, let me orient you to the environment of the community. So we have, so this is the OHDSI Teams channels. Depending upon what you have signed up, you will see the various work groups inside the OHDSI tenant. One of them with this logo is the new work group. Today, obviously, is the first meeting of this work group. So there is a general channel, and that's the only channel. You can see a lot of spam from Patrick Ryan. You can ignore him completely. He's not an important person, as you all know. But this is the post that you all received about the meeting. We will use this channel, this thread, for communications. This will also trigger emails for those who have signed up. The way to sign up for this work group is to go to the OHDSI website, and there's a chat thread there that allows you to go and register. It's a Google form, and then Elise Katzman, who runs the OHDSI backend, she will put you into the work group. If you would also I have the administrative privileges to add you directly to the work group. So if you would like me to add you to the work group, please let me know. The calendar invites are sent through the MS Teams environment. Sometimes it could be tricky based on how it's configured in your institute. Sometimes institutes will block a Teams email notification. So if you want an Outlook email invite, please let us know. This work group is coordinated by 3 people. I am the lead of the work group. Gaurav Dravida with the co-lead, and Lana Shubinski will help us organize this work group. So she will manage help content. So if you have any questions, please post them, and one of the 3 of us will respond to you and attempt to help you out. This is a collaborative group. This is not a support group in the sense that we are all volunteers. So we'll try to help out, but there is an expectation that you contribute your proportional share to the work group. Now, so I'll show you. I'll start with my slides. I'll show you the way we will organize the content. There is going to be a folder under the file section. In there is meeting, slides, and presentation. That folder will contain the content that is disseminated in this work group. We are following the OHDSI principles of open science, and so we are everything that is being done in this work group is in the public domain. I've requested the Microsoft Teams administrators to make this entire work groups channel public. So in other words, anybody with an URL, even without an OHDSI tenant access, will have at least a view access to the documents. As of right now, you have to be just member of this work group, but I'm trying to make changes to those. I also lead another work group called the Phenotype Development Evaluation Work Group, and that work group is made fully open, so anybody with a link is able to discover and review content, which is not the case as of right now. In the landing page of these files, there is 2 main documents. There is the work group's vision, mission, and core objectives. This was posted and shared in the community on July 2025. Gaurav made an announcement 2 times at the OHDSI community call about the work group. At the same time, because we are almost at the end of 2025, I've taken as the chair the prerogative to make the OKRs for this work group for 2025. Moving forward in 2026, in the beginning part of 2026, we will collaborate, we'll discuss and agree on OKRs. But because of where we are in 2025, I've taken the decision to just put the OKRs for the work group. So we'll start with the work group's vision. So we are called the Health Economics and Value Assessment Work Group, HEVA. I try to call it HAVE, HAVE, because it sounded better, but then I felt like it's not, so let's just keep it a what you see is what you get kind of name. So we are Health Economics Value Assessment. Previously, in its previous iteration, it was called Cost and Utilization. Cost and utilization, although it means similarly, I felt like the name Health Economics Value and Assessment has a slightly heavier connotation, because at the end of the day, we are looking to deliver value through our scientific innovations to the patients that we serve, the providers that prescribe or provide this intervention. Value is defined as the highest quality at the lowest cost. And that's what we're trying to estimate and measure. So the vision is in line with OHDSI's vision, a world where collaborative real-world evidence provides a comprehensive understanding of value, accelerating patient access to innovative therapies within a sustainable healthcare ecosystem. So the context involves the idea of cost and quality. So our mission is to empower the OHDSI community to improve health by collaboratively generating reliable evidence on comparative value and economic impact. This work group will develop and promote open source tools, standardized methods for evidence synthesis, and we will do it in such a way that it meets the evidentiary requirements of health technology assessor bodies and payers. We will help inform medical policies, and we will also enable value-based reimbursements. That's our mission. That's what we do. So we have core objectives. We want to, first of all, the OMOP common data model has a very rudimentary way of standardizing cost as of right now. At least that's my opinion, and it's also the opinion of the majority of the Odyssey community. So we want advanced data standards and methods in representing cost. OMOP common data model is the foundation for doing standardized analytics. So we want to lead use case driven evolution of the OMOP common data model by proposing and standardizing extensions to cost, payer, and other health economic data. We want to also, we not only just randomly develop it, we also want to empirically evaluate it. How good is this changes and how does it work in terms of value assessment? Because at the end of the day, it's not sufficient to just create this representation model. We want the output of analytics, standardized analytics, acceptable for regulatory decision making, for patients' decision making. So we want to develop open source analytics that support this. So Odyssey has an opinionated way of doing things, of representing data, an opinionated way of representing data, an opinionated way of methods, an opinionated way of software. So we are in line with that philosophy, and that opinionated methods will be represented in open source analytics stacks within the Odyssey ecosystem, thus empowering the community. And obviously, at the end of the day, the goal here is to generate high impact clinical evidence and to do this in a multi-stakeholder collaboration. You heard in the introduction, we have stakeholders from many geographies across the world. We have people representing academia, industry, and technology sectors. So this is a very broad community with multiple stakeholders trying to work collaboratively on one mission towards the vision of collaborative evidence generation. So this is the OKR. Again, as because where we are in the launch, this is something that is prescriptive. As the chair, I took the prerogative of prescribing this for this year. In Q1 2026, we will do this collaboratively as the work group grows. So again, the mission stays the same. The objective of 2025 is to revitalize and reintroduce foundational health economics and value assessment capabilities into the Odyssey ecosystem, so that we can do standardized research on comparative value and economic impact. To achieve that objective, we are working towards 5 SMART goals, key results. The key result 1 is around data standards. So we want to have standardized representation of cost in the OMOP common data model. And we want to achieve some form of a consensus around it. So the way I worded it is to deliver a comprehensive implementation-ready proposal to the Odyssey Common Data Model Workgroup for reintegration of the previously community-approved cost and utilization specifications into something we will call as the CDM 5.5. So what does that mean? This is a revitalization of an old work group, cost and utilization work group. That work group worked with the community to develop representation standards for cost and payer concepts. Those were accepted by the Odyssey community and put into CDM version 6. CDM version 6 had a lot of major breaking changes. One of the breaking changes was the adoption of date time. So you could represent September 17th, 2025, 9:23 a.m. in the CDM. As of in the CDM version 5, the representation was only September 17, 2025, only date. The usage of date time broke the OHDSI software, and there was a lot of problems that it created. So a decision was made to dissolve CDM 6 and go back to CDM 5.2. In that transition, the work of the cost and utilization work group to introduce cost changes was lost. And so what we are trying to do now is to bring it all back and propose to the community that, hey, this was previously discussed, approved, let us now put this back in CDM 5.5. That's our key result number 1. Key result number 2 is to attempt to shift the stakeholder perception. There is a general perception in the OHDSI community that health economics and outcomes research is something that OHDSI is not able to do. So we need to change that perception by introducing this capability, by communicating this capability, by validating this capability, so that stakeholders from pharmaceutical industry, from the payer community, and academia are more willing to adopt OMOP Common Data Model and OHDSI software for performing health economics and outcomes research, health economics and value assessment. And that's the second key result, that we want to achieve communication by end of quarter 4, 2025. Now, just saying that this is how you can represent cost is not sufficient. Adoption of the OMOP CDM cost table requires a clear specification of extract transfer load ETL conventions. How do you convert a licensed data set that a pharmaceutical company or an academic institute may have, or a hospital system has generated, into the OMOP CDM 5.5 that has the cost representation structure? So we're going to also, as part of this work group, by the end of quarter 1, 2026, share the consensus with another work group in OHDSI called the Themis about ETL conventions. And then hopefully by the end of quarter 1, 2026, have at least one large organization adopt this convention and ETL their data into the CDM 5.5 for cost. The next key result that we are hoping for is by the end of quarter 1, 2026, be able to have a alpha version of the OHDSI cost and utilization software. So we'll have to have the functional requirements and then a working cost utilization package on the new CDM with successful execution on at least 2 external research projects by quarter 1, 2026. This could be a simple characterization study and some of an average cost, but we need some execution by quarter 1, 2026. And then the best practices, we want to think about the best practices of conducting cost and utilization studies using OMOP. So you know, the Book of OHDSI is undergoing an upgrade. So hopefully we can write something for the Book of OHDSI and get that in as this work group. So that's a lot. So I want to hear any reactions, reflections on the OKR.
Gautam, I just had a quick question for you. So when I think of like helping to contribute to the CDM, and you're trying to also scale this out to different health systems, be it the United States or elsewhere, we'll have to take a lot of consideration with regards to, for example, the United States will have third-party liability, you'll have deductibles, co-insurance, etc., and that's going to help contribute to the model. How do you envision, from an OKR perspective, to scale across other countries, let's say Germany, etc. And how do you take that into account? Just wanted to get some knowledge from you on that.
Absolutely, absolutely. So the way we'll roll this out, so I have it's an aggressive goal, hopefully that you'll all support. In this meeting, let's talk about the physical structure of the OMOP CDM. In the next meeting, let's dive into how cost is represented across the world. Obviously, like you said, the US way of representing is different from the European way of representing. But then the goal is to standardize them. So what is the equivalence mapping of the same cost idea in the US versus Europe versus other parts of the world? Then how do you map it to the standardized concepts in OMOP so that when we standardize it, the idea of certain types of cost as represented in the standard concept ID is the same, right? So how do you solve it? So I'm hoping to achieve that in the next meeting. And in the third meeting, we want to achieve some methods to work on it. So it's an aggressive timeline. So today is about the structure. Next one is about the mapping, the ETL conventions, the standardization. And then the third meeting is about the software, following the OHDSI framework of standardized data, standardized methods, and standardized software. But we can't just do this in one meeting. We need to have smaller subgroups talking about it. So Ram, I would love to have a smaller group with you to talk about these ideas in preparation for the next meeting. And that's how we should roll because of this aggressive timeline.
And just one little follow-up, if you could add to the OKRs validation
Yes.
against some kind of benchmark, because whatever we're going to put out there, it all has to get validated. Again, an example would be if you were to get costs for the United States, we could use Milliman Care Index that gives you the PMPM or premiums per month, and then you can benchmark. So same thing for the whole community here. It would be nice if you could think about, one aspect is OKRs, but how do you validate them against publicly available data?
That's fantastic. So so obviously if your feedback is being recorded, so I will use AI to transcribe this and update the OKRs after the meeting. Sebastian, you have your hand up.
Sorry. Yeah, thank you. Maybe I wanted to add to what was just said. Maybe not just in different countries, there will be different standards on the data. But I think, and the latest example was quite telling, I would say. It was also different when you want to represent cost in a CDM, when you want to use this data for, let's say, efficacy studies versus when you want to be able to, let's say, summarize or characterize the cost. So maybe it's also good to start with this aggressive timeline, also to start with a specific use case and scope it down like that, because there will be different requirements to the data for different use cases.
Absolutely, and doing a comparative effectiveness with cost as an outcome is a much higher bar than calculating a PMPM on a group, because that's a characterization. So you're absolutely right. The ways to do baseline adjustments for a comparative study is the bar is much higher for cost, I would say, compared to like a dichotomous outcome like cardiac failure or some side of adverse event. Cost is such a skewed distribution. So lots of challenges. I agree.
Maybe also, I'm not sure, but I was also joining this meeting because I'm interested in not just how cost is supposed to be represented in OMOP, but also what are the ideas about from different researchers or sites to use it. What is so I'm not sure if there's consistency on that, or sorry, not consistency, agreement on that shared understanding, but that may be part of the OKR too. To have input from different stakeholders about how they want or would want to use it when it is validated. That's just to add that.
So Sebastian, I think what you are bringing up are good topics for preparation for the next meeting, which is the cost standardization. So Ram, and maybe you, Ram, I, and anybody else interested, please raise your hands or send a message on the thread and we'll capture it. I will create a channel to synchronously and asynchronously talk about it, and we'll prep for that session. Awesome. All right. So slides, we talked about the HEVA work group, the mission and the core objectives. We talked about the OKR, and I've talked to you about the work group logistics. The content for today's meeting is all on this forum thread. So I've been running OHDSI work groups for a long time, and I felt like having a long running thread of just can't for what dedicated for one group is a good way for people to keep track. So this is the thread for this work group. If you have any reservations on this approach or have alternate ideas, please let me know. But as you can see, the work groups has we have links to the Microsoft tenant. We will record these and put them on a YouTube place. The reason for YouTube is because it is one-click access to most people across the world. The videos that are recorded in the Microsoft tenant for some reason is not accessible. So we just wanted to make it more accessible, and that's why these things will be posted on the YouTube videos. So there is also the link to the old thread. The old thread had the cost and utilization work group. It has, again, the things that we went through, the vision, mission, and core objectives, the sign-up place that I talked about, the OKRs that we just discussed. So they're all in one location. And for today, this is the topic. This is the agenda. This is what we want to talk about. Actually, in this thread, I was thinking about it this morning about how to run this work group today. And we have a meeting today on September 17th. This is today's meeting. We have a meeting on September 24th, and we have a meeting on October 1st. And all of this is in a weekly basis because we're ramping up to the symposium, which is on October 9th. So we want to try to do this compressed timeline to achieve as much as we can before the symposium. So today the topic is to reviewing and finalizing the proposed modifications of the cost table, that is the proposed CDM 5.5. And I've talked to the leaders of the CDM work group, Christian Reich. Because this is previously approved by the OHDSI community through the formal CDM review process, we are most likely going to be able to put this in CDM 5.5. Although an official proposal has to be reviewed by the CDM work group, but before we submit it to the CDM work group, we need to review it here as part of this work group, get your inputs, and then agreement. So that's what we're trying to achieve today. So here is the topics that we need to discuss. I will show you two items. If you go to the meeting section, there is two folders here. This folder, that date and the intro was the presentation that Gaurav Dravida gave to the OHDSI community in the OHDSI community call, talking about the work group and inviting all of you to that work group. This is the kickoff, that is today's meeting. Inside this, I have the PowerPoint slide that I just shared, but most importantly, this is what we're going to focus on, this Excel sheet. When I'm going to open this Excel sheet, I'm going to first orient you to the Excel sheet. So there's two tabs. There is something called a cost, and then there is something called a payer plan period. These are the two core tables that we are recommending to the CDM work group to make changes on. The structure of these two tables are very similar. So there is a column that is called the field name. There is a column that is called in 5.4. So it's a yes or no answer. There is a column that says in 6, and remember CDM 6 is now deprecated. It does not exist. This is the proposed CDM 5.5. So what we are doing essentially is keeping all the field names in the CDM, comparing 5.4 existing version to deprecated 6, and then making choices about which of the approved 6 should go into 5.5. Essentially changes to 5.4 to make it 5.5. And the discussion reasons for it is here. And these are links to previous GitHub posts on the Common Data Model Odyssey GitHub repository, where there is discussions by the community along with approval. Claire did a wonderful job of putting tags about what was approved and what was not approved. And all of these are approved changes. So the structure is again the same. So the plan period has the exact same structure that follows it. And again, thanks to Gaurav and some of the group members who are here who did the prep work, helping create this content for the work group to discuss. This morning, I summarized those here. Again, what we're doing is reintegration, not reinvention. The problem that we are trying to solve today is how to efficiently incorporate normalization and structural elements approved by CDM6 to enable HEOR research in the 5.x lineage while maintaining backward compatibility. And this is extremely important. We want to maintain backward compatibility. We cannot introduce breaking change to CDM. CDM6 introduced breaking change. We have to bring in things from CDM6 into CDM 5.x without breaking any of the software. And that's a very tall order, but we want to achieve that. There are some key ideas that I want to bring forward. So this is the 4 key, we can think about it as principles of CDM6. CDM6 converted a wide format. So the CDM 5.4, which is the current version, has cost, but it is in a wide format. What does that mean? It has specific cost columns. Like Ram mentioned, those cost columns have names that represents US ideas, such as allowed amount, paid amount. They do not exist in like an European setting or maybe all the rest of the world. So they represent the US third-party payer system, which makes it very hard to generalize to non-US settings. To solve that, the CDM6 introduced a long format, so essentially a very long EAV format, entity attribute value structure, which allowed it to handle diverse cost types, including rebates and adjustments and so on. So that's the key idea here. So we're going to reintroduce the long format back to 5 without breaking the wide format. So we'll keep the wide format, but we'll make the table long format. Very interesting problem, but we'll solve it. There is a principle of person centricity in the OMOP CDM. Every table in OMOP has the person ID. If it's an event table, if it's a clinical event table, it has a person ID. The current cost table does not have a person ID. That makes it very interesting challenge where if you want to do a join, you can't join by person ID. That's interesting. Plus, for hashing the data across a distributed database system, the distribution key is almost always person ID. There is no person ID in the cost table. So from a performance point of view, it's bad. From a query generation, it is bad. And it violates the principle of OMOP. So we want to reintroduce person ID, a previously approved idea. Temporality. Now, there are in cost, when you do health economics outcomes research, there are different types of dates. There is the date that the patient actually received care, which is the incurred date. But that's not necessarily the bill date. The billing can happen before, they can pay in advance, or it can happen after. And then there is also the paid date. When did the hospital system actually receive payment on? So all of those are kind of important information, incurred, billed, and paid. And we're going to capture that as part of this cost table. The service date is captured in the visit table. So we have that also. The payer table is currently not standardized. So we are going to reintroduce what was approved for CDM6. The idea is of who is the payer, what is the plan, and who is the sponsor. The payer is just the person who does the payment transaction. The plan is the benefit design, and the sponsor is the group that is holding the money. So we're going to represent those in the payer plan period table. This post rehashes that the CDM6 was stalled. We are bringing it back. Some of these are repetition that we've already discussed. The details of the proposals are structured. This is the same content that was in the Excel spreadsheet, but it is being reintroduced in a blog format with GitHub issues referenced here. So structural changes and linkages, normalization of the field. Because we are shifting to the long format, the cost field is now a new field and is a generic cost. But what type of cost is it? That's represented by the cost concept ID. OMOP cost table right now does not have a cost concept ID field. It has a rigid structure that says the column name describes what the cost type is. But instead, in a long format, you can use a cost concept ID that represents the type of cost. There's also the cost source concept ID, which would help us represent the non-standard way it was described, and the cost source value. We'll also introduce the cost type concept ID. Now, this philosophy of type concept ID, source concept ID, source value, and concept ID is consistent to the general pattern of the OMOP CDM. So if you look at the procedure table, the observation table, the condition table, they follow this pattern. So it is similar to that pattern. So we change by reformatting the table to the long format, we become consistent with the rest of the event tables of the OMOP CDM. Again, all of these changes were approved by the CDM workgroup for version 6. The three types of dates that I described, incurred date, bill date, and paid date, will be added. Again, previously approved, and that's in issue number 81. The legacy cost fields, this is the current named cost fields, like they're called the total charge, total cost, total paid, paid by payer, paid by patient, paid patient copay. All of these are fields, I think, in the current CDM 5.4. They will be made optional. So you could populate it if you want to. You're discouraged from doing that. You can just keep it null. But the reason we will keep those fields is just for backward compatibility. So if somebody wants to use these fields and has a script that they are running, they can still populate it. But for our standardized analytics and also for network studies, these will be completely ignored and hopefully dropped off in the future version like CDM6. There was an idea called cost domain ID. This, believe it or not, is a text field. Despite all the innovation of concept IDs in OMOP, the cost domain ID, which basically said This cost is coming from a procedure. This cost is coming from a condition. This cost is coming from measurement. That was entered as free text in the CDM, and it currently is still a free text. So we're going to make that, we're going to deprecate that idea or make it optional, and that also was also approved by the CDM workgroup. Instead, we'll be introducing a new field called cost event field concept ID. Now, this is a concept ID, it's a number. So this is an OMAP vocabulary concept ID. The OMAP vocabulary concept ID will say which table and which field is this cost attributed to. So if this is a cost that is from a visit, that's an inpatient visit, it will represent that in here. This makes it very clear about where is this cost coming for. So it allows you to write SQL queries or queries that allows you to connect and understand very detailed microcosting. There was a lot of debate in the RDC community about these fields like revenue code, DRG, and but where should that be? It did not fit anywhere. They belong to the observation domain, but they are structurally represented in the cost table as of right now. So the recommendation that the decision that was made previously was to remove them from the cost table and put them back in their appropriate domain table. So if they belong to the observation, it's an observation domain. It goes to the observation table, and the vocabulary decides where it lands. Because we have the linkages and we have the event concept IDs, event field concept IDs in the cost table, we know that this revenue code is costing so much and this DRG is costing so much. So we can always link back, but it's not in the cost table. The previous argument was we want a very wide form of a cost table with DRG codes and revenue codes and paid amount and allowed amount and so on, which became very complicated to manage. So I'm talking a lot, obviously thought about this. Before I go to the next table, anybody, any questions, thoughts?
No, it's very clear, but and then some thoughts, but for a later stage, I would say. But interesting. Thank you.
Absolutely, Sebastian. And please, this is we are going through a very compressed timeline intentionally, but we have the asynchronous communication open. So you can use the forum, you can use the MS Teams channels, we'll monitor it. Your feedback is extremely important. Your experience is extremely important to get this going. But we are not doing a debate or a discussion about new proposals. This is all bringing back old ideas, old approved ideas. We just, reorganizing it.
And in accordance with the current convention, so that's also important to be aware of. Yeah.
Absolutely. The reason for the compressed convention is because this has been done before, right? So we are just accelerating it. So the payer plan period. The payer plan period has been discussed in GitHub issue number 120, and it has who's the payer, who's the plan, who's the sponsor. It also has the contract and the family structure information and termination details. It's a little detailed and so complex to explain because I only have about 5 more minutes in this meeting, but happy to discuss more. But those are all in the thread, in the linked references. These were discussed before in the Odyssey community. I followed it up with just linkages summarizing each one of these detailed posts. So issue number 81, cost table changes, add person IDs, dates, and normalize. Here is the actual forum post. It is live. You can read it. You can go to the issue number 81. There it is. It has been closed. It has been approved. It is accepted. There is documentation. So there is the long thread after discussion. This was my initial post. So the way it worked, just showing you the history, is I made an initial proposal that went through iterations and discussions and agreements and lots of forum posts with the community discussing about it. And finally, this version, which went to the top, was the accepted version with the good tag and CDM6. So this is how we are doing this. This is, you know, just showing evidence that this is historical work that we are bringing forward. Also dated 2017. We're bringing it back from 8 years ago. So 367, issue 367, same create concepts. Decision was made that instead of having all these ambiguous names, text names for these tables, we're going to use concept IDs. We are going to change all IDs to big integers because we're modern computers. Why do we need just integers? We can do big integers, and then these tables can be really big. And because others were complaining that why these integers are just stopping at 2 billion or something. We got more, our data is so big and this is not working and so on. So all of this has been captured here. So I want to conclude my monologue and just get your thoughts on, as community, what do you think? Thumbs up, thumbs down on putting this as a note to the CDM work group saying, here's 5.5, fully specified, brought together. Go ahead, Gaurav.
Sorry, yeah, I meant to put a thumbs up, but yeah, I mean, I think we should do it. And honestly, for everyone who's kind of new to this, I put some links in the chat that you can look at, but the biggest thing to do is look through the forum posts and like understand those conversations that they're all having, because they had these conversations in 2017, like Gowtham and blah blah blah. And if you understand that and truly let it like seep in, then you'll like make some contributions to these calls.
So the action items for you all is, please, we made an effort to summarize all of this and made it easy for your input. Please engage on the thread. Please engage in the Teams channels. If you are shy to do it publicly, send us a direct message. That's fine. But we'll want to capture your thoughts. This is a community effort. This is a collaborative effort. And we would like this to be proposed as a group to the CDM work group with prior discussions, and then get it formalized, hopefully before the symposium, which is on October 8th, 7th, 8th, and 9th. Excellent. Thank you, everybody, for this wonderful meeting. I'm looking forward to the next week's meeting, and next week we'll have a smaller group. I will start a small thread there in the Teams channel. If you want to be part of understanding how to ETL the data to this new CDM 5.5 proposed to be validated by the CDM work group, that's your opportunity. If you have ideas about how cost is represented in different parts of the world, this is the opportunity to talk about it. This is if you know the different types of cost categories that needs to be represented, this is your opportunity to contribute to it. Gaurav and I and a few others have made progress. We'll share those documents. So we have accelerators just like this. And again, many of these was ideas from the cost and utilization work group of the past. So we're just bringing it together in a very structured way, just revitalizing it. So these are not new ideas, but if you have something new that you want to contribute, this is your opportunities to do. All right. I will stop this meeting. Go ahead.
No, I was thinking, but thanking you. It was well prepared. Thank you for setting this up like this.
Absolutely.
Thank you all. See you next week.
Yes. Bye-bye.
Yep. Thanks for joining, guys. See ya.
Thank you all. Bye.